Good morning. Good morning, everybody. This is Engineer Suraj Singh speaking from Bharat, India. On this day, May 15th, 2021, Saturday, with proposal of a talk, title being Civil Field Engineering starting with COVID-19 as a professional issue, designs, construction methods, contracts, AnnexSL, organizations, quality, quantity, etc. You can see every day I'm interested to talk to you about this issue, and if it works well, it's okay. And the certificate of chartered engineer, and the certificate of professional engineers, and of course certificate of this professional engineer, chartered engineer, hello, these speak something, and we should respect them in life. Otherwise, there is no meaning of these certificates, though there is no meaning of quality, there is no meaning of COVID if we don't follow it up. And so some report here, and of course there's something here. I'll take some time on COVID because day by day it's getting very interested. Meanwhile, I'll close these files so that less memory is used, and I start with some, you can say, talk on this. I published yesterday. Every day I publish this, usually those blastings, these files which are a text one of, you can say, this text file of my everyday analysis that is done for information to people of our country and world, what's happening in ours, India, Bharat, and around world. And that's Bharat India COVID-19 report May 13th, 2024, which are reported on May 14th, 2021 by Government of India, published on their website. I collect data from that website and try to analyze as much as possible to let people of world and ours understand, know what is fact and what is not fact. Title always being Bharat India daily cases, whatever number it was reported yesterday, 343,144, you can say 3.43 lakhs, 3.43144 lakhs, which is 343,144. Every day it changes based on 237 days analysis, and there's 270, I mean to say, is this analysis. You can say in this case, this is another file based on which this is 237 analysis. So this day of 14, for my analysis it is for 40 days. It's not, you can say, I can't say it's analysis. And an analytical informative talk view on COVID-19 plus variant stay status for May 13th, 2021, reported on May 14th and 2021. Government of India GOI provided data, worked out spreadsheet file for national awareness. For Government of India has been sleeping. This is usual. I read it like that fatalities that's being reported amount to, at least to an extent, 33.333% only. And absolutely fake figures are being published by Government of India. Fake figures, I mean to say, fabricated one, because Government of India is not an independent agency for this work. They are government, and they shall never like to publish something which goes against them or against reputation of government or image of government. So this has been discussed at many forums. Experts are speaking many things. So I'm just taking a factor of 1/3 this report is, and 2/3 we have to add on to that. This report is dated May 14th and effective date is May 13th. And this also I declare the following data has been included based on Government of India portal based information, which includes only those individuals that have been admitted to hospitals in private as well as public or recorded otherwise. Saturdays, Sundays and holidays generally cause reduction in cases. This is very much general, and data pertinent those who have been located at home or not recorded and lost their lives elsewhere due to COVID-19 is not included herein. Ours, Bharat India, has officially crossed COVID-19 daily cases numbers too. That is 3,43,144 on 13th May 2021. Government of India trying to play with numbers now. Inefficient organizers who manage the Government of India has drastically failed in handling COVID-19. It's not an allegation, it's just an observation by an independent analyst. Again multiplying very efficiently. More than 50% people are expected to be COVID-19 hit in cities. Extremely bad state of testing and failure in war scale vaccination. Why have Government of India been fooling people and world by showing lesser numbers of fatalities and also lower number of infections? Real data projection shall help nation. Why should we as a nation hide facts? Why should we as a nation hide facts in public health relations? Risk controls, no answers from nation. Do not be deceived by vaccines, no hints for risk management or marginal erosion. Do not be misled by vaccine because it doesn't amount to treatment equivalent but just an augment immunity level only. People shall have to pay for vaccines except for frontline workers. But this is old one. There have been so many changes on this. Let us see what happens because health workers are granted what then it came to private sector as well. Now private sector I think is not authorized for this. Despite inoculations, one requires to resorting to entire precautionary measures such as wearing masks all times, using eyeglasses all times, and maintain safe distance all times. This is my observation, general observation. Though many countries are going against this, like USA, they say our people have been vaccinated, so remove masks if you can. Well, it's their headache. It's no good at this moment. I can't comment on that. If officially, experts say they may have thought something, might have thought something on this issue. I'm not expert. I'm just observer. Wearing eyeglasses are significant for speed of virus entry to eye through eyes 50 times of speed than speed with which it enters through nose and mouth. No plans provided for provisions of vaccines. Even very slow speed of vaccination, lowest percentage wise in the world is Bharat. India must improve too fast its efficiency of vaccinations or else no use of if it takes decades. Speed of vaccination is for only, you can say on an average it is 1467721. This is only 14,67,721 average. I am saying I'll show you in the file where it is first dose plus second dose total equivalent per day average, which is too low when compared to requirement of 1.42 crores per day. You know that it is average. I'm taking 1.42 requirement, keeping a factor of 91 days the whole population be vaccinated and a factor that 130 crores we are of first dose and second dose respectively. With this speed it shall take 886 days. Every day this number I change depending on how many people have been vaccinated. It shall take 886 days for each dose for 130 crore populations inoculation. Now it's a summary of what's fact. Summary is Bharat India COVID-19 strain variant report update. Conclusive facts I am giving you. I will not give complete, I will not speak on whole pages. I am just giving you informative requirement. COVID-19 strain variant report update on 14th May or May 14, 2021 forenoon. COVID-19 strain variant cases have gone much beyond consideration of, you can say, they have gone much beyond. This is also old figure 20,000 Bharat India, which is very much concerned. Will issue this shall harm very lax in future and is doing. Vaccination started, but only 17.929 crores, or you may say approximately 18 crores. That is equal to 13.792% combined for both doses. I am taking 13.792%. It's in relation to 130 crore population, and therefore the 17.92 crore is 13.792%. That's in relation to population combined for both doses of population inoculated till May 13th from 16th January 16th, which is certainly too low value. You can say January 16th, February, March, April, May 16th. May 16th, which is exactly today, is 15th May. In 4 months, we have done only 13.79 percentages. In 4 months, this means in 1 year we will do only 42%. So you can see yourself how slow it is. 13% in 4 months. 13%, this means about 3.5% in 1 month. So you can say how much time shall it take. Total tests conducted up to May 13th is equal to 13 total tests conducted were 31.13 crores. This is 311 million. Total tests conducted up to 13th. This is only this much, and you can say this is very small quantity if you compare to 130 crore people. Tests conducted on May 13th, 2021 is equal to 18.755 lakhs or 1.875 million, or you can say 18,75,515, and total corona infections till May 13, 2021 is equal to infections are 2.404 crores according to official figures, 2.404 lakhs. You can say this is official figures. Positive infected cases declared on that day of May 13, 2021 is 3.43 lakhs or 343,144, and this changes every day, sometimes up, sometimes down, depends. Based manipulated data by government of India trying play with numbers of now. I say manipulated data because this is not exactly recorded. This only recorded data which they do, but other data they are not giving. Those people who are not able to test or those who are not testing, you can't say what's actually actual status. Average percentage of current 7 days test. 7 days means recent 7 days test. This is percentage of that. Declared positive to those tested 20.26%. I'll show you this data. I'm just trying to tell you 20.26% is equal to 26.33 crores. That is probability in whole nation, and percentage of those tested and declared positive on report day is equal to 18.296%. That is 23.784 crores. There's a difference of 26.33 crores to 23.784 crores. So this is because of 1 day average, 1 day and 7 days. I think 7 days has to rely upon. So we can say 26 crores people are probably in infection. 23.784 crores contractions probability in whole nation. Now that's update till 12 May 2021. This government says this is 262,317. That is 2 crore 62. That update still this much, yes. So 2,62,317. That's government says so many people have gone, but facts may be different. Population tested is 23.948% only since March 2020. You can see efficiency in 14 months is 23.948%. That is about 1.5% per month. So you say how many months shall they take if they test whole population? Remaining population remaining without test is equal to 76.052%. You can say it's almost 3/4 people, only 1/4 have been tested, approximately less than 1/4 you can say. And time required for whole population testing is gross is 1261 days, and according to current speed it is 959 days. So we cannot wait for around 3 years. Assessment based actual figures for infection and deaths using multiplication factor 3 on Government of India reported data. Daily infections being now daily infection is 1.02329 million. I can say about more than 1 million. This is 10 lakhs. You can say 10 lakhs 29,432 daily infection assessment. According to assessment, I use the factor of 3 for this assessment. Whatever government's data is published, I multiply that by 3, and this is assessment according to my understanding. It may be wrong, it may be right, depends. I don't have exact figures and no one is publishing that. And daily deaths being 12,000 because government published 4,000, so it is 12,000 deaths updates being Updates being 786,951. This means this is that so far 7,86,951, because I multiplied that total deaths here, which was, you can see here, deaths updates 26, 23, 17. So it gives this much, though it's maybe more, but let us, because I am using factor 3, so it is answer, it may be 4, maybe 5. Infection updates is that is 7,21,40,427, 7 crore 21 lakhs. Now certain facts, it's very, COVID-19 testing of citizens never ever worked successfully. This is my comment. Since March 1, 2020, and we had plenty of time till now, and since then. People of Bharat, India thought that they shall be tested to detect whether or not they are negative of COVID-19. They thought that, contemplated that, but there has been no testing plans initiated by any government in India, and nobody actually knows at this stage how many citizens have been contracting COVID-19. In 440 days since then, we have tested only 23.948% of the population, as I earlier said. Do you think this is justified? Why did our Supreme Court remain silent, and Government of India remain silent, and people remain silent? And why did all opposition remain silent? No testing for 76.052% people have been left. They have been left without conducting any test. In fact, 80% people have gone without any test, because many percentages individuals have repeated their tests. So you can say only 1/5 have been tested practically. Poor have not been tested because it's not affordable for them. If a nation cannot test its subjects, how can we claim that Government of India has been working to fight against COVID? Government of India has been a sheer failure and got no interest in welfare of its people against COVID-19. Vaccinations plan is not available, and capacity of vaccination productions and inoculation is not available. Government of India can spend 20,000 crores on useless structures, but live public is no objective for them. Shame on ourselves, whole nation. I'm not saying shame government, but shame all on whole nation. PM and people of Bharat, India have been responsible for this human-created tsunami. Blind support to every regime results in futility, because we are not a serious awakened society. We have acted as if we are slave to self-appointed international PM. Modi must answer these failures. Bharat, India, some more comments about this. COVID-19 strain variant much more than probable thousands cases of strain already detected in ourselves. In our country, Bharat, India, this virus has already spread to more than 100 countries. UK had also warned about India variant, which is very much mutation able. People of UK had been very much against this issue. And also today morning I read one news that UK is very much concerned. They are thinking, because of this virus, Indian variant 617B1.617.1.2.3, that it may risk their releasing from June lockdown. So they have to continue probably. That's their serious concern. And it's not UK. This will impact on many countries where it has gone. Officially it has gone to 45 countries, but I think it has gone to 100 countries, though in negligible portion. UK scientists had warned whole world the Kent strain variant virus could spread over to all vertical areas. No controls access prior to Christmas. Bharat, India has no plans to contain it, and inoculation of vaccines speed not very encouraging in this country. Bharat, too slow speed, and all there are so many others you can say. But our important point is that Bharat, India inoculated only first dose plus second dose to an extent of 18 crores of total population, that is for phase 1, Dose 1 is 12.413%, I can say, and dose 2 is 1.379% only for first dose considered 90% coefficient, and for second dose I consider 10% because exact data is not available. It may be 95 or 5 or maybe 85, 15. Actually analysis can be done, but I'm not getting separate information for every state, so it's difficult. If I find that, I'll exactly tell how many percent people have gone to dose 1 and how many to dose 2. What is schedule? We don't have any information. Single dose vaccinations are required, that is 1.425 crores vaccinations are required every day. If we have to finish this job in 91 days, it's job's job. This activity cannot be delayed for years. Job is very expensive, very expensive in terms of money as well as in time. Also, it risks lives of people. Of course, it will not treat people, but it shall augment immunity levels of everyone. We have failed in testing of populations at all levels because 76 to 77% people have not been brought to test in more than 440 days. All these citizens belong to poor and lower middle classes. Whole world must laugh at our performance of testing. With current speed, it shall take more than 2.5 to 3 years for accomplishing testing, if at all we do. Same, there's one benefit of testing. If you had tested long back, so 8 months, 9 months back, 1 year back, or 6 months back, you can say, depending on volume, at least people could be isolated or positives, and this community spread would have been avoided. I can call this community spread, in fact, Delhi or crowded areas and now even villages. It's spreading to people, and one doctor told me, we go outside and see those walking in Delhi, everybody, or at least half, must be having positive. So it's very risky. It's like community spread. It's like community spread. Same may apply to inoculation of immunity providing vaccines if no schedule is prepared for its implementation. Many weeks back were reported 1.3 million cases from USA. It was also then facing cases more than 62,000 daily. So we are much ahead of that. We are facing millions and millions daily. We can say about 10 lakhs per day. The government is saying 3 lakh, 4 lakh. Alleviate was alerted that USA had closed 2.4 crores COVID-19 cases now. I'm leaving you. This paper is available. On Facebook postings. Every day I do that. You can see that. I'm not going to read all this. Important points I have told you, and then there are some general points in that. Now there are many. This daily information I put on this, and that is here. This is tabulated information from government, and then there are URLs which I am using for that. I'm not going to talk about that. Now I'm going to actually discuss which is important file, very important file, and that is this file which is being used for this purpose. And you can say this comments. This file is also available on script.com. These are so many comments. I'm not going to waste time in these. You can see yourself this. Important point I'm telling you that I'm using these, first of all, these 5 informations. That is deaths update, that's daily positive numbers, infection updates, and daily tests conducted, and also total test update. This 5 information I take from government site, and also this information, that is what I'm telling you is this information also I'm taking from government side, that is daily vaccination and cumulative vaccination. This I am using table for multiplying all this information by 3, and I'm just informing you how I am working on this. This is all dates, all these are all dates here. You can see days, and I'm moving on this. What I'm doing, I'm not going to tell you. Actually, I'm not taking much time on this. The 5 information, that this is 440 days we have covered if you count from since 2020 March. This 130 crore population, and this test percentage every day, too small, you can say negligible. And this information is of this date 14th, and entry of 14 is yesterday. and this is for 13th, actually record is for 13th. So this is the total number of tests we have done. You can see that this test we have done, that is about 31 crores, 31.13 crores, and this is just 23.95% of whole population, and 76% population is still waiting for test, or there is no plan for test, and it's 18.76 crores. You can say we tested this report, for this report 18.75 lakhs or 1.88 million, and of course this is total number of cases 24.04 crores. These people have been tested so much, and 30, this information is 3.43 lakhs. It updated report of on yesterday, this is 14th May, this report from government for 13th, and that is 3.43 lakhs or 343,144 positives were recorded, which is of total tests done. If you take percentage wise this value divided by total number of those who are tested, you will get 18.3% on this day. And also these, I am taking these 7 days, 1 2 3 4 5 6 7. I'll take average of this as well as this. Based on this we'll find status, and this is total number of deaths government wise, that is 262 317, 2,62,000, that is 262,317 total deaths according to government, and this 4,000 is daily that yesterday recorded. And these are independent day, I mean to say that day, yesterday's or reported day vaccination, and that is total vaccination. If you see total vaccination and find percentages, it is 13.792. So let us move further. This is average, I am not talking about average, it is average. Now we say here on this speed, this is 70, 75, 55 average tests per day, which is too small, too value. So I'm just going for reference only. And 98.87 crores people have not been tested, and if there is no meaning anyway. We needed 1.083 crores. Still we need 1.08 crores tests per day, which is not going to happen because we are testing somewhere between 14 to 19 lakhs per day. So we cannot say immediately 5 times, or we can increase the speed. So according to this, 959 days are required, which is extremely difficult. And we can say then I'm taking first of all this. Then if you take these 7 days, here it is 1 2 3 4 5 6 7, and this is percentage I am taking from this table above. So 20.26% is average, and according to that 26.33 crores people must have probability of infection. And if you consider only one day, that is 18.3, so it is 23.78 crore people must have infection. And if you this another table, that is multiplication factor, actual daily cases, personal assessment, it is not government data, actual total real deaths and actual daily deaths, infection update, and that is 3 factor. And this is you can say 12,000 one day death, and here is infections, that is 1 million, more than 1 million, and this is total number of deaths so far, assessment death. And you can say this is infection update is crores, 7.2 crores till now, that's what it says. And I will go back to other point, and it's vaccination. I just tell about vaccination, that I say this is fraction of vaccination I have taken. First dose 0.9, second dose 0.1, and it is, we say that we vaccinated this day of report 20 lakhs, 20.27 lakhs, and total 17.93 crores, 17.93 crores, and percentage wise it is 13.792, and requirement is this. So requirement is this, and we are testing only this or this. So 1.425 crores requirement, and we are doing 0.2 crores. So 1/7 we are doing only 1/7. 1/7 or 1/8, is choose though out of 7 requirement, we are just vaccinating 1, and that's it. And now I'll go down again. If you see this, we need, according to this speed, 886 days, and that is very much issue of concern. First dose is 12.413%, second dose is 1.3979, and this 886 days we require, but we should have 91 days. If we can do it 190 in 91 days, we should do 1.424 crores per day, and that cannot happen. That's not going to happen, we know. And now let's go to see. This is our data we worked out based on, I mean to say, whatever we have. I multiplied this number 3, this is number of deaths every day, and this is infections. So we can say total number of deaths have been till now, means this was 4.9 according to government data, because I multiply by 3, and this is number of infections, let's say here, some of that. But this is not total so far, this is from some datum, and that is here. So don't depend upon this, I'm just informing you how it works. And now I'll go to graphics of this, which is very independent and clear one. You can see graphics here. This is graph number 1 and 2. This is positive since 31 August. You can see how this curve is moving, and there's many fluctuations here now. This means this is not real information. There is some game plan going on behind this, and if you go further, you will find that this graph 1 and this graph 2 here. This graph 2, that is test conducted numbers, and this is from beginning itself. What data I have, I'm not saying beginning of March, but whatever data I have since August 31st 2020, and they go further, you will find that this is number positive cases in April, May. For clarity, I am taking bi-monthly here, so you can see this curve. And also I'm just giving this detail because I consider this engineering detail. Analysis is job of engineers, and I'm just utilizing my knowledge to disseminate this information, because this information is not available in government. There is no representative from government who is working on this. There's no representative on television channels who are working as such, and there is no press media who is giving details like that. Press media, actually I've seen people in the press like Indian Express, they used to do a lot of work before. Hindustan Times is a lot of work before. Now no one is working. I think it's problem of mathematics, or it's problem of devotion or dedication. They don't value this analysis, that's why they're not doing. It's only statement, it's only no criticism. And this is, then you can say here, and this is another chart, and that's tested positive, percentage of those tested positive in April, May. You can see in April beginning it was slow, 6.43 something, then go gradually rising down, falling, rising, falling, and it has gone in such a way that 11.59 here, 12.39 here, 14, 20, 25, it's going on increasing gradually, and 24.47, and now it is 24.33, and then coming down. So it should be like this actually, like that. But who is to care? That's a point of concern. There's no one to care, so we have to care, because ultimately we are client of this nation. And then it is April, May, that's death data, same thing. It's saying, they are saying 4,000, so I'm depicting the same now. And this is your death data, and here vaccination numbers every day, daily vaccinations. There's no clarity in that. It's like we are doing, we are sleeping, we are doing, we are sleeping. No one is serious. There is no perfect template of this curve. You can say no profile, no parabolic, no hyperbolic, no line. Just to say number of lines. If you find number of lines here in this period of vaccination, you can say it's happening like this. And then you go to items and vaccination cumulative, and that's vaccination cumulative. And you can see steep rise. You can see here it is a gradual incline, a steep another, and it is like an uphill task here. And then you can go see. This is April, May. This is what happened is this is infection. Cases. When I say cases, mean infection, and this in April, May. You can also see how it's rising, and maybe they say it's peak now. I can't say, and then they may say in percentage of infected to test, and this is that one. It is of course, and then in percentage infected of COVID since 2004, and this is here in percentage wise. This is 18.3 now. It was 24 before, and also this is actual assessment. Is now I'm talking assessment, and this is your assessment. Infection assessment, which is more than 12 lakhs per day here, and you can say this is daily assessment infection daily, and this infection is daily. It's also going to be like that, 12 lakh something, and here is assessment deaths. This assessment deaths. This is more than 10,000. That's why I can say I'm not giving another page of this file because that is Excel, and it's not easy to print again. And just because that's available, you can see that on the website. This was that for important for me. So I hope that you got my point, what I wanted to stress on, and also I can say this is now commenting point I'm coming to. I close this file now and now because of quality requirement, I have to do quality job as well, and of course we have to talk of COVID-19 in general terms, in professional terms, because of quality requirement. And when we say quality requirement means we have to, in addition to application of engineering, we must say quality non-conformance product is called substandard and therefore rejected. So our attempts to contain COVID-19 have been substandard, and we can say whatever we've done can be called rejected. Now this COVID-19 related deliberation, it is very small deliberation, professional deliberation, meant for everybody, and for engineers. HSC, which stands for Health, Safety, Environment, Ergonomic Support. These three subdisciplines, I should not call subdisciplines actually, these are in every branch of engineering, and you can say this can be called dominating subject, or you may say starter, dominant starter, dictator, and also guide, director, whatever you can say. It applies from 0 to 10, 9, it applies everywhere, A to Z, or even if you come from Z to A, it applies. It's very important part in life, not only in work, otherwise also. Health, safety, environment are very important point, and we have to concern them accordingly, because environment, health and safety, and supported by understanding of ergonomics. Ergonomics means proportional use of energy we have, and that energy should be used in such a way that we do not feel tired, we do not feel uneasy, uncomfortable while working, and we should spend that much energy, which is basic requirement for construction workers or crew handling all activities. With double energy we can waste time, or with intelligent use of energy and understanding of how to work in best way, we can say ergonomics can help us. Health is very important. Safety and related to health are very important. If our workers and we are all safe in working, we take care in every attempt. The health should not be adversely impacted upon, and environment should not be degraded by our stupidity, by our ignorance of knowledge of safety and how to work. We can say when we ignore, we can meet accidents, fatal or otherwise. And if we do not ignore, we care of this, then construction workers, other workers, crews, handling, they can organize very good way. Engineers can organize best way, and work can move on smoothly. And that's very important point. And of course, we are talking of COVID-19, which is a powerful attacker on entire humanity. COVID-19 is teaching us another world of safety. COVID-19 has become very professional teacher for us. It has become top professor of whole world, not only for one country, and actually it's not only for whole world, it's for humanity. It's teaching us that there can be any kind of jeopardize in life, any kind of jeopardy in life. Just we can say JHA. We say, you can say job hazard assessment we call, sometimes we call job hazard analysis. So this is both analysis and synthesis, and this is assessment. Because COVID-19, we cannot take it for granted now. It's top everywhere. COVID-19 is master now. It's now principal. It's now dean of whole world. There is no country left in world which is not concerned about this. It's a most powerful attacker on entire humanity, and this has in fact changed all lifestyle of our people. And what are related facts we have to analyze? Related facts are 50% world population that has been infected, I think, belongs to our country, belongs to ours. When I say ours, this means our country, India, Bharat, and that's a point of concern. Previously, we thought we were comfortable that we have contained COVID-19, but that was our country's mistake, our country's overconfidence, and that should have been avoided. Because first of all, so far nobody knows what is COVID-19. Nobody knows facts, how it started, how it generated, and how it's working. Still, we do not know. No imaginations of that, scientifically, no explanation of that. So that's very important point. We have to make ourselves ready in every affair of life. Medicines are required. Of course, medicines are required. These are not available in ample means. We don't have ample requirement, ample availability of this material. Then what we say, we are in real trouble. Bharat, India has been in real trouble, and we have been facing issues and facilities issues as significant. We have been facing acute shortage, or you can say unimaginable shortage of oxygen, medical oxygen. Actually, transportation is a major problem. Cryogenic supply tanks are required. The short in supply for shortage of cryogenic transport carriers. Cryogenic, you know what is cryogenic? I did not explain, but when some liquid is kept at minus temperatures, for this separate kind of metal is required, steel is required, some other material is required, and that is called cryogenic transport carriers. We don't have. Even they are talking to some other countries. For example, I remember Singapore has committed something, many other countries did. So cryogenic transport carriers are required. We are analyzing like that. This government says that okay, fine. They did not think of this 1 year back, but it's now fact in life. Hospitals ask question mark because there are no plenty hospitals I mean to say standard hospitals like AIMS, like many other in our country big hospitals, and everybody cannot go to private hospitals or corporate world hospitals, which are very expensive. Yes, top person people, 10% people may go, who have crores and crores with them, but average person, average citizen like me, who cannot afford such hospitals, and we have to take this point into our consideration, that public hospitals is a requirement which we did not bother about. So hospitals is very big issue, and not only hospitals, we should have required number of medical professionals, doctors, nurses, health workers. In hospitals, buildings are not hospitals. These workers like doctors, nurses, other housekeeping workers, ward boys, etc., etc., they are required. Buildings are available, they can be converted to hospitals. So we have main point oxygen, transport of oxygen, hospitals. These are current hours requirement, which I think we ignored before, because we are status of sleeping lot. I can say that we are a society of sleeping people, non-serious people, not only sleeping, non-serious. Even if we get up in time or early morning, we are not serious about anything, not meeting unexpected requirements. Our hospitals have failed, or partly successful, you can say, meeting such unexpected happenings or requirements. Beds are not available. That's another big point. I have seen news which is very, very grim, very disappointing, that in the one hospital, Lala Lajpat Rai in Meerut, UP, people used to bring their beds, folding beds from home, so that they could put there, or even some patients were still on floor. It's tragic, We can say beds are not available to meet demands. Doctors' strength is also a question mark. Shortage for COVID-19 meeting. They are working too hard, certainly, for sure. Nurses also working too hard, for sure. Health workers working too hard, for sure. But ventilators, question mark. Many, many questions. Infections, assessment is more than 1 million a day. Okay, we leave aside formal data. Why to worry about formal data when we know data is not absolutely right, and government also cannot confirm that. They are getting information based on what statistics they have, but everybody is not going to hospital, everybody is not going to nursing homes, everybody is not even testing. So there are people, maybe many times than reported, who must have COVID, but they are not on record. And also that's, if people are not infected, they are not recorded. That's all. When they are not in hospital, they die at home or elsewhere. So where shall this information go? So what I say, that's also important point. Now we say experts. I have seen many videos of experts from all over the world, including our country, assess more than 1 million persons already left for their heavenly abode, permanent home. It's what they assess. More than 1 million people have already gone till now, and this is around March or May. May 15th, mid of May. Cremation grounds, no place for new bodies. Dead bodies, or even say corpses, a few are incurred. They are given tokens. So no place for burial or for cremation or for pyres. Electrical funeral is also not working efficiently. Crematorium. And what about poor? No concern. Cremation ground, no place. What about poor? No concern. You must have seen bodies floating in Ganga, in UP as well as Bihar, and maybe in other parts of this country, in whatever river, I can't say. We cannot pinpoint, we cannot name a specific area. So I am just giving reference to UP and Bihar. It can be what elsewhere also. So this is very, very, you can say, never ever expected this state of our COVID-19. There is only country currently where bodies are floating in rivers. Really, It will go to another problem. I also got news that dogs are abusing these bodies, birds are abusing these bodies. Maybe birds and dogs or someone else infected, and it will act as super spreader of COVID. So there is no concern for poor people, and question arises, though it's not political question, it's question of anguish mind. Where is government? Does any government exist? Does any government exist? I'm sorry, this is government side, it should be government. I apologize. Does any government exist? What we should do? That is a question mark. What we should do? That we could not understand till now. And we are moving and moving and moving. What we should do? Test all immediately. Why not entire population tested in 14 months? This is a question mark. And if people are tested, exposures will come out, those who are infected. We know who is infected them, and we can easily isolate those people. Maybe according to statistics 25%, 20%, 18%, even if they are 15%, even if they are 10%, lower percentage is better. Because countryside, or you can say in county now, in villages now, our remote villages, this COVID-19 has entered, and because in villages population is spread, possibilities of percentage may be low, but COVID exists there. Maybe it is 10 to 15%. Even if we take 10% population, let's say half of village and cities, and let's say 75 crores people living in villages. So if we get 10% even, so this goes 7 to 8 crores. That's a big one. 7 to 8 crores in villages, possibilities. And in cities it is 20%, let us say, half of that. So 20% plus 10%, average is 15%. 15% population is what? 15% of 130 crores. This is 20 crores. Mind it. Shall we survive? Question is, shall we survive like this? No scheme for testing. No scheme for testing and for inoculation. Well, there's some error in writing, I think. No scheme for testing and immediate inoculation. There's an error. It should be immediate. So inoculation by government, but panic must be stopped. There should be no panic at all. Things must work to come out of such world population, world problem. We are actually a problem at this stage, I can say. We have converted ourselves to a problem, and we should now think of that. It's no question of political requirement. It's no question of political party. It's question of nation. It's question of citizen. Okay, we made mistake. I know nation made mistake in assessing situation, in realizing that we will face, and government announced that we are free, announced by mistake that this problem has gone, but we could not understand this would never go like this. And I'm also assessing not only for our country, for whole world. For our country, Bharat India, I also published before that up to December 2021, it's very risky period, and of course up to December 2022, there's another risk for both COVID. We should not think that will go in a couple of months. Technically maybe, but otherwise, even if it doesn't impact much, it will stay here. And don't think that immunity that we achieve by vaccination would work. I have seen many people, even after being inoculated, lives are gone. It's very serious issue. We should not only take care of how to get or contain COVID-19, but also how to continue in our construction world, because we have groups of people work on sites, and we have to take their care also now as well as in future. How should they work, avoiding contraction of COVID-19, because they work in groups sitting together here and there in many ways, even skilled workers and unskilled workers. We have to think of them, how to handle them. Construction workers means 70% of our fund go to construction, and it's very important part. I like to take some example from here. You can say the safety issue talk. say management system, safety policy. Let us say safety policy first and see what it says. I'm just referring it, I'll talk it later on. This is safety issue. What it says is organizational broad quality policy. This is very important one. I close the file and I'll take a file. I read this, what was it now? Says this chapter 1 of safety, I'll take it later. Already I've taken last videos, but I think there's not been much response, but I'm just refreshing it what I took in that. And of course in that presentation was not done of screen share. It's organizational quality policy. Organization means companies or whosoever you can say. Organization believes into adopted policy of lead contracting to aid to development of nation, development of state and development of society. Organization believes into, when I say organization means wherever we work, I am speaking as such, I am head of that. Just imagine like this. Organization believes into produce, deliver and with assurance each best engineering products, I'll just put it on, I'll blow it up so that you can see. So organization believes into produce, deliver with assurance each best engineering products at optimum cost using efficient, available and procurable infrastructure and resources to serve reputed customers. Clients need by action of which to earn its reputation. You can say an attempt is required earnestly to deliver products or projects efficiently with value added over to fulfilling requirements. Customer must get what has been paid, what customer has paid to producer, to manufacturer for such delivery. Value engineer delivery certificates. Value engineer delivery certifies and assures organizational commitment in competitive environment. Top organizational management believes to employ suitable qualified key organizers and key personnel with proven track records, professional base, international professional base, considerable construction, relevant business experience. All organizers, key personnel are directed to ensure that following description scheme policy is implemented to an extent feasible. Just in reference document, this is what is scheme, what is policies. All employees on all levels are suitably qualified to meet job requirement, and only right man is placed for right job. Everybody is clearly explained about assigned job descriptions with an undertaking obtained from respective key personnel or personnel in writing to do job to best employees' capability. This is a kind of complete we'll talk of. And before that, going further, I like to say here one more file which is also very important one, on which will depend that what is safety management system. There are so many things we'll talk of, and we'll talk of this, and let us see. Actually I wanted to get something else. Hold on please. That file where has gone, let me find out again. Excuse me for 5 minutes. Sometimes it happens I miss so many things because complexity of documents, and I can say it is called safety first. You can say safety first. Yes, safety first. That's the important point. It's only 4 pages, but let us say what is that. When we say safety first, it's a big indication that how important is safety. And safety first does not mean that safety is first discipline or ruling discipline. It doesn't mean that. It means consideration. We are talking consideration. What is value of safety? Safety means our life is safe. Safety means our health is safe. Safety means we should work in a way is required, and is no one is unhealthy. Work is safe, person is safe. We can say we go back home safe, and generally in a laughing way, with somebody tease, somebody we used to tease. You are in one piece. Means we don't want in two pieces. That's what it means. That's a joke. Now it says construction projects have been required since times immemorial. More than 50% budget is covered on development works, which more involves construction projects pertinent to all types. Engineers from all disciplines work on such projects. Millions of workers contribute to such development around the globe. Engineering has been a very significant world to successfully deliver all such projects. In fact, generally not very literate workers are involved in this world of construction. Literate means literate by education, formal education. I'm talking of work education, which is not available. Many accidents have been experienced on such projects due to reason of carelessness or neglect of work and supervision. Everyone is interested to do a fast delivery of proposed product at risk of personal attention and not caring for life value. Created anxiety inculcates a feeling to make delivery at appointed date, even not availing ample rest and sleep properly. I have personally observed that works are not given adequate attention from safety viewpoint, despite safety department exists, methods exist, everything exists. Carelessness cannot be replaced, by carefulness. If those people who involve on work, they should know what safety is. If they do not know what safety is, how it works, well, I think I have no answer for that. Only answer is keep an eye on them, stand on them. Stand doesn't mean on them, I mean to say be with them to tell all time what they are doing, they have to do. Though safety is too significant on such works, but it is not given value to be strictly complied with. Incidents have been reported regarding collapse of crane booms, scaffolding and collapse of crane booms, scaffolding and building slabs, shutters during ongoing construction around world. Scaffolding was a failure even on certain international airport during construction. For some transport system, failures on supporting works have been reported. Indeed, on plant facilities, safety care is intensively ensured. Even after so high level of safety care, bad incidents have been reported. I understand my duty to share my experience about safety requirements with fellow professionals in engineering construction sphere so that experience dissemination be effective. Included with this publication are many topics about project construction, safety respecting practical aspects on activities conducted. Only few statements have been included that may cover a large scope of common construction faced by common engineers and particularly to help support problem solution that are faced by budding engineers. Many safety organizational management statements have been included from policy making to tools handling and then taking off to actual works on site. All activities could not be covered, yet an idea has been conveyed about questions in my mind. More statement and methods about how to handle safety issues can be developed. First chapter, 35 chapters involve. I'm just giving reference to book. I'm not going to study that now. First 35 chapters involve with methods. line management, site, middle, and executive management organization. Certain sketches have also been composed for information purpose to apprise about requirements. Chapters have been based on actual works affected in field as part of office engineering, field engineering organization without including imaginations. Many years of information have been used to produce this work. A model organization chart or integrated management organization chart has also been included just for reference only. Certain activities have also been mentioned that require checks on site. Hope readers will enjoy this talk, and then it's my interest and purpose of this work is to assist those aspiring professional engineers who are unable currently to refer to certain practical books. So it's a kind of CPD involvement, you can say. It's kind of work of CPD, that's continuous professional development, and I deal with all this. Construction method statement should assist actual work prosecution on sites and cannot be extracted from available books on globe. Similarly, no text areas available that provides comprehensive information about projects, prosecutions, strategies, and it's always problematic for engineers to refer all such documents. Result to that lack of information leads to drop from management levels. So this is, you can say, there are some chapters which I name in this, and those are safety policy, management or organization system, site security, hand tools, first aid regulation, permit to work, housekeeping, safety training, emergency and evaluation plan, fire protection, personal protective equipment, which are abbreviated PPE, excavation safety, control, storage and use of hazardous materials, incident reporting, lifting, rigging and hoisting, radiography operations, night working, scaffolds and ladders, temporary electrical supply, welding and cutting, working at height and fall prevention, abrasive wheels, and construction, environment control, hazard controls, confined space entry, road safety and vehicles operations, reward system, compressed gas cylinders, heat stress, safe practices, disciplinary enforcement, site or the safe work, inspection and audits, plans, facility project, construction safety relevant sketches, safety related sketches, organization chart, etc. So this is what I thought should be. These points we'll discuss as time comes, and this was safety. We'll go to now other issues of quality. Policy we'll discuss later on. Quality, and I'll open talks file now, which are important for us, for everybody, and this will be same. Go back to, and this is point detailed engineering facilities petrochemicals. So I open this file, quality requirements. All right, I'll just give something about this. 8 building design concept, and 9 is procurement facilities, and let us see 9. What's that? I'll also open page. This is 9 procurement. I'll also open construction facilities petrochemicals also with this. And also I open another one, and that is quality requirement. Leave it now. We will talk of this first and see how it works now. So this is, let's go to 5 first, 9 first. Of course, I have been doing this, I talked with this, but it's still refresh here it is. What we talked of in that. Because if you don't refresh, it remains confusing all the time. And quality says everything should be clear, everything should be fine. This is very important title here. The title or conclusion you may say, and this is application must be a factor which is equal to engineering. A factor of application is engineering, and before application it is method of science. It is science that tells us what to do. It may be engineering science or it may be physical sciences. Applied sciences, you can say science which applied, and once it is successfully applied, it becomes part of engineering. And if we say there should be something in that product or application, and that's called quality. And if quality is not conformed, it's not applied correctly, it's non-conformance, you can say product is non-conformance. Product is called substandard and therefore rejected. So let's go to procurement, and which is very important part in our work. Without procurement, first of all, nothing is possible. Without procurement, you cannot think of anything. It's not procurement of material, it's in procurement of services. It's not procurement of material alone, it's procurement of services. It's procurement of what we say, everything that goes and goes. It's procurement of everything that goes and goes and that works and works. And it's like that, It's procurement of what we, that's a problem always, that we never care for planning. Actually speaking, procurement is reality of life. It's not purchase alone. Purchase, of course, you have to pay for procurement. So what it says, contractor. When I'm saying contractor, it doesn't mean contractor only. It means even if there is no contractor, you're doing yourself. If you are doing yourself, you are acting your own contractor. So here contractor includes everything. Contractor shall perform procurement and expedite all materials and equipment necessary for performance of work in a timely manner and in accordance with execution program. We can say, what is procurement? That's first question. Procurement means procurement of requirement, procurement of what is necessary, and it should be before that necessity arises. Procurement of services, procurement of material, procurement of all types of material for temporary works, material for preparatory works, materials for permanent works, material for maintenance work. And you can't say today I use this, tomorrow today I procure this and tomorrow I use it. That's not expected and that's not accepted in world of construction engineering, because engineering, you cannot say today I buy and today I use. That is not engineering. Even temporary material you buy, for example, material for scaffolding, which is important one. Maybe it's for temporary work, but temporary works leads you to preparatory work, and then preparatory works leads you to permanent work. There are different ways. Procurement of everything. Sometimes even absence of nails stop work. Absence of nails stops work. People sometimes don't understand. In Libya when I was there, they used to say, listen guys, You're talking all times. This is not available. That oh, nails. What is nails? Very small item. But they don't understand. Without nails, shutting work cannot be done. Form work cannot be done. They say, oh, you're talking of nails all the time. Always you eyes upon this is available, this is not available. What I do is required. This means this was requisitioned, items were requisitioned, requirements were requisitioned, but due to whatever reason, if I don't get material, I will hold organization responsible because I am very small guy on site, remote areas, location, and I always sit in that desert camp like soldiers do that. I too. But what's function if my procurement is not available? When I say I need this material on this day, depending on indication or you can say expression on schedule or interpretation on schedule, I require this material on this day. This means material should be available on site, duly in working order. I mean to say duly approved by those responsible. Because just material is not enough. It should be approved. This document should be approved. It should be approved in the best way. We cannot simply say unapproved document. No. We need document that is approved one, and that's where we can say the responsibility lies. If I am not able to procure my material in time, there's no way I can do project. There's no way. What shall I do on site? As an engineer, as a foreman, as a manager, what's my role? No. In engineering, maybe people are not clear. Every moment is important. Yes, we plan schedules, master schedule, you can say look ahead schedule, and of course many types of schedule we prepare. We prepare lengthy work. We employ top class planners. We employ top class engineers, and they work a lot on them. But their work is successful only if it is perfectly implemented. You see, making a schedule is not easy one. Making a schedule is not easy one because we have to keep project cost or budget first of all in consideration. We have to work out quantities of every item. That's also not easy, time consuming. And they have to go through process of procurement, and which is a very long one. On official projects I'm not talking a home project. I'm talking about projects where relation exists between various parties on contract, employer and contractor, employer and services engineer. Relations exist, and those relations cannot be condemned. And there are various roles in everywhere. And we should not forget that material part of procurement is about 60%, 70% certain cases, and work person's coefficient is 15 to 25% depending on approvals of disciplines that have been included and depending on quantity of those disciplines, which may be services disciplines or other materials. We have to buy these materials from certain source, directly or through some agency. Those people from whom we buy, we call them sellers or vendors or suppliers or subcontractors, or you can say whatever we can name. It doesn't matter. I consider that these are all sub-parties, and we have to deal accordingly. We have to work out these quantities. So what we say now, which says that contractor shall be responsible for performance of following activities, and which are Identification of material procurement. Identification of material procurement requirements and preparation of a procedure for company client approval. It's very important point. It's not that simply I procure, I buy material and use it. On projects, on contract projects, where huge money is involved, where there's engineer, there's a designer, there's a planner, there's an architect, maybe other professionals, and on other end is contractor, who have all classes of professionals. And there is a system defined, execution method defined, and it's a practice and we have to get approval of all these materials from owner through engineer. This means on those projects which are formal projects, which are contracted projects, bound projects, and if FIDEC may apply, may not apply, doesn't matter, but procedures do act. Procedures are defined. So for purchasing those materials, first we must have approvals of those materials. Yes, that's important. You can't say that during project we will find those materials. This means when you tender, what you do? You assume that this material is available, you have evidence of that. And also, if that is not available, you can't price. You got my point. If you don't have availability of material confirmed, you don't have source from where you take that material, buy the material, you can't say I can price it. You can price it only during pricing time on bid, you either got some quotation from that vendor, or you know very well that vendor is available and we can procure this material from them within this range. If you are experienced party, you can ask those people phonically or by quotation, and they will quote it if you know them very well. But that's not a point here. In our construction life, there is no one material that is to be purchased. All materials are to be purchased, and these are not only purchased directly, these are first approved for construction. Means if you have to use approval during your construction, you must have complete background of procedure that procurement is done by. You must have a set policy in your organization, and consultant must know that policy. During tender itself, you must have got quotations. If you don't believe in assumptions, if you don't believe in imaginations, you must have invited quotations from those people. And we do it generally. Means we invite from various vendors quotations and see which rate access in market, and then based on those rates we work on analysis of rates, and that analysis then gives us price wise, itemized price. We can say lot exercise there. First you have to take quotations, you have to invite quotations from their party, from vendor, and you feel this quotation is okay, and whatever vendor is offering is according to requirement, according to specification, according to drawings. If you think that, if you consider that these documentational conditions are applicable on this material, and this material conforms to those requirements, and price wise also you think it's beneficial or it's okay, it suits, then you can say you can get approval of that material during currency of project. Even if it was included in your tender, in your bid, again you have to do. And once you get approval, means you are lucky if you get approval at an early stages, then you have to place for order of procurement. And if thing now is not worth, there's some comments you clarify, and you can ask for that. You can go for that. But you have to keep in mind that time is limited. Procurement time is very limited. So you cannot keep on waiting for others to come. So you may say, when you need complete quantity for placing order, after approval is done, that quantity must also be available, worked out by some professional. So you can say we start with identification of material, procurement requirement, and preparation of a procedure for company client approval, and then we can say preparation of all materials. Take off. I'll go back in a few minutes. Meanwhile, you can go study this small page, because I'll be back. I'll be back in 7 minutes. Okay. So we can say now proceed further on this issue, and it works. Let's proceed further on this issue of procurement, which is a very important part. I talked something on this. So what's required is that in procurement we have identified material for procurement or services procurement. We have identified requirements and preparation of a procedure for company client approval. So material submission made, material approval submission, you may say form is filled and all details of materials are given, whatever details possible are given. Material agency, manufacturer specifications, required specifications, means complete specifications, documents, references given, and of course if necessary quantity may be given but not exactly necessary. So we have to move through procedure of material approval, which is very important task, very important part when you have to procure material. And once you get approval of that material, even another approval can be taken in case of risk, because sometimes these companies, these organizations may not be able to deliver material in time, or there may be some other reason. So you may take some other approval depending on your understanding between engineer, owner and yourself. So we say material approval is over, and then you can say once material approval is final, you can go on after quantification to place order for that material or that procurement. Means when I say preparation of metal takeoff, means quantification is over, and based on this quantity, rates may vary, time may vary, preference may vary, because every manufacturer, every vendor likes to have major quantity delivered, not small quantity, because even in major quantities there may be rates fluctuation. You may get some benefit if quantity is more, and time is also not very long, means immediately material is manufactured, it can be dispatched. Then you can say, of course we say preparation of requisition for purchase order, we have to make purchase order for preparation, so that's all process. Then expedition is very important. Expedition, you have made submittal, it's approved, you have quantified material, you have placed requisition, you have placed purchase order, but you are not only customer for that manufacturer, there may be many more customers in other projects. Priority is important. Priority, your priority you have to define on your you can say you have to define on your invitation, and that manufacturer who quotes has to define that he complies with those requirements, those conditions, and even then it's done. You see, after all, we are all human beings and everybody has his own interest, so we must employ, if quantity is important, its quantity is considerable, that our man, our person, our representative should follow up sincerely. Not only this material, all important material which are time bound, that follow-up is important. Material follow-up, particularly material delivery follow-up. I'm not saying coordination is different. I'm saying someone should follow and make sure that process of manufacturing is in line and process of dispatch is in line, and it has to be made sure that we will get timely material, and also progress on site is also, progress of site is in line. So all vendor selection, evaluation, etc. we have done. Then maintenance philosophy is also important. So we can say our material must reach in time. That's very important point. We must have taken care of warranties regarding that material we are following up. There are so many materials in all disciplines which are warranty bound automatically because these are permanent materials and must be conditioned with some warranty. Now, when material is manufactured, it's also sometimes necessary because it's expensive material. Our offshore representative be available there. So this is not necessary in standard materials, but if it's something like heavy equipment where we need quality control there, we have to make sure quality moves. We may have to send our representatives there, or third party certification may do. That happen. Inspection testing of all these materials by third party. Then before it is transported to offshore from there from factory, means transportation of materials to site, including packing to sea freight and air freight standard, all must be taken care of. And after, once we receive this material on site, once it is delivered, storage, preservation and handling at site must be taken care of. The spare parts must be identified and taken care of. Then it must be inspected by responsible authority. We call it how to handle spare, means preparation and issue to company client of completed spare parts, interchangeability forms. So, inspection of material arrived must be done. Information must be given to authority, and if it's required, testing may also be done. Then we have to move to, you can say, pre-commissioning, commissioning, all that's later on. Then vendor payment is different matter. Efficient use of materials means whatever we get, first of all it should comply to required specifications, and it should also comply to quantity requirement, and it should also comply to storage, how to handle, how to protect it, etc., etc. This is just a brief I am giving you for procurement. It's not necessary I have to explain everything, just indicative explanation. What is purchasing, how actually generally purchasing is done. Says that in mechanical world the system may be different because of expensive machines, expensive vessels and expensive, we may say, where our engineer or client must be kept informed what we are doing. And it's no repetition, just you can say purchasing, because contractors are responsible for following purchasing activities, means RFQ preparation, that is prepare request for RFQ specification and documents for all equipment and materials in accordance with project specifications. Then, like that procedure I told you, which has to be complied with, and you may say it was technical bit evolution, it must be there, and clarification must be made if required. So this is all that we expediting I have told you. And if we go to certification, is also important here. Certification, which is actual final stage and other stages, well, says that Contractors shall be responsible for arranging and coordinating use of third-party services where required for equipment and materials in country of origin for statutory, insurance, or whatever other reasons. Minimum requirement of third-party services is provided in some details of exhibits. Such meeting requirement shall in no way relieve contractor of its responsibilities under contract. Third party shall function independently and report him simultaneously to organization, company, client, and contractor. List of company, client approved third parties or contractors is given, and you can find out for you from that list. Contractor prepare a certification matrix in accordance with requirement of exhibit of appendix for company client review approval. Third party, what has to do is also a question mark. Check project equipment and bulk material list. Attending kick-off meeting and pre-inspection meetings to specify and ensure that entire quality requirement has been met. Review high criticality rating of equipment and packages before placement of purchase orders. Actually third party, though it's third party, but it has to work on same pattern as one party, because it has to check at every point. It has to check smartly, means not point to point but at random, each and every way that it leaves no point untouched or no requirement untouched. And if it's untouched, means it shall have to explain later on how it could not inspect that. So you can say attending kick-off meetings, etc., etc. You have to do high critical rating. You have to check MSA equipment and their packages before order is placed. Must make sure, based on information provided with, that what the contractor is going to do is right. And you can say ensuring that type of certification required by company is compliant with requirements. We have to make sure this. Reviewing vendors' data requirement list and identifying those documents required for certification purpose. Checking that standards requested by company or client have been implemented for a wide range of products and minimal approach has been adopted. Reviewing, certifying our vendors, reviewing and certifying vendors' quality plans. That's also important. Their quality plans, manufacturer's quality plan and specification for procurement certification level. It should tally with us. It should be compliant. It should be in line to what we expect. Conducting monitoring visits to vendors to review procedures for generating certification. Reviewing documentation prepared by vendors as part of final documentation, ensuring that all special requirements for equipment procurable to be installed and become operational in project processing service have been complied with. Shipment and freight forwarding. Contractor shall be responsible for sanctioning release of completed equipment and materials for shipment after satisfactory completion of final inspections and certification, and should execute forwarding activities for all equipment materials, including long lead equipment items. Contractor shall be responsible for organizing and coordinating packing, marking, and transport of equipment from source of supply determined in purchase order to construction site. Shall work. Such work shall include preparation of seaworthy, airworthy packing, marking, shipping, and documentation specifications, inspection, certification, as case may be, for packing, marking, and loading, taking responsibility for authentication and shipping documents, including certificate of origin by National Embassy Consulate, develop plans and procedures for freight, forwarding, handling, and custom clearance of equipment, materials, to ensure that all freight then inspection certification case may be packing, marking, and loading, taking responsibility for authentication, shipping shipping documents, including certificate of origin by National Embassy Consulate, and develop plans and procedures for freight, forwarding, handling, and custom clearance of equipment, materials, to ensure that all freight is consigned to arrive at construction site in time. Organize and ensure timely shipment of materials, equipment to construction site. Prepare, maintain, and issue a monthly shipping progress report with monthly shipping forecast in a format approved by company client. We have to make sure that organize and ensure timely shipment of materials, very important. Arrange for import of all materials and equipment purchased for receiving and of loading at construction site, including organizing and securing approval from relevant authorities. For shipment and transportation of heavy and bulky equipments and materials, contractors shall give preference to plant port. Okay, God shall provide, says arrange for import of all materials and equipment purchased for receiving and offloading at construction site, including organizing and securing approval from relevant authorities for shipment and transportation of heavy and bulky equipment and materials. Contractors shall give preference to plant port while importing materials. Plant port is a modern port and has necessary facility like exclusive heavy load berth, cargo benefits, cargo berths, etc. to facilitate project import material. Contractor shall provide its own hired crane facility for all loading and offloading operations at heavy load and dry dock berths at plant port. Contractor shall be charged by plant for use of port facilities, which details of such charges are given separately. Contractor shall comply with plant port You know, plant report plant port is a modern one and has necessary facilities like exclusive heavy load berth, cargo berths, and etc. to facilitate project import materials. Contractor shall provide its own hired crane facilities for all loading and offloading operations at heavy load and dry dock berths at plant port. Contractor shall be charged by plant for use of port facilities, which details of such charges separately given. Contractor shall comply with plant plant with shall comply with plant port regulations included within appendix. Air shipment or sea shipment, inland transportation and custom clearance. Contractor is fully responsible. Contractor is fully responsible for arranging inland transportation, sea air freight, legalizing authorization of certificate of origin and other shipping documents, voyage insurance, customs clearance including payment of custom duty, legalization fees and transportation respecting all equipment materials to construction site, storing and material traceability. Storing and material traceability. All equipment and materials shall be carefully handled and stored in a designated area at construction site. Fragile equipment sensitivity to weather conditions such as instruments shall be stored in totally enclosed, heated and or air conditioned room. All equipment and materials shall be carefully handled and stored in a designated area at construction site. Fragile equipment sensitivity to weather conditions shall be stored in totally enclosed, heated and or air conditioned room. When installed, they shall be protected from sun or from sand. Ingress by temporary shelter or plastic sheets. Handling, preservation, storage of equipment materials shall be carried out in conformance with vendors' instructions and company client specifications. All materials, including spare parts, shall be subject to an appropriate traceability procedure so as to ensure an easy retrieval of materials and related documents for each item in all circumstances. For this purpose, the contractor shall provide experienced personnel for warehouse management, organization with goods involved inward-outward control, utilizing PC-based software, allowing status progress at all times. Spare parts, okay. While floating RFQ, constructor shall instruct vendor to indicate requirement of spare parts as shown below. Commissioning spare parts. Commissioning spare parts. Spares for pre-commissioning and commissioning both come under commissioning spare parts. You have to first use spares for commissioning and commissioning then. Initial spare parts. Spare parts to safeguard operation of equipment during start-up, running and first year of operation. Spare parts for normal operation. Spares for day-to-day maintenance for period of 1 year following initial operation. Contractor to ensure while submitting their quotation, vendors shall provide description of spare parts, items, number of units, recommended X work unit price including seaworthy packing. Company client shall not approve any purchase order to be placed unless accompanied by 1 year operational spare parts and capital spares list and prices. So purchase order is to be required to be approved by client. A specific requirement is that other purchase order. Pre-commissioning, commissioning and initial operation and maintenance of spare parts and others. Contractor shall procure and supply pre-commissioning, commissioning and initial operations and maintenance spare parts, chemicals and lubricants. It's very important here, the kind of specification you may say. A kind of specification it is. have to be very considerate of this. It's not that easy as you are thinking. It has to be considered in every respect. And we say pre-commissioning, commissioning and initial operation maintenance, spare parts and others. Contract shall procure and supply pre-commissioning, commissioning and initial operation and maintenance spare parts, but chemicals and lubricants, special tools and handling gear for each equipment as necessary up to completion. So I repeat, contractor shall procure and supply pre-commissioning, commissioning, initial operation and maintenance spare parts, chemicals and lubricants, special tools and handling gear for each equipment as necessary up to completion. Contract shall develop a procedure for proper receipt, stacking, storage and handling of spare parts and provide all supply services in accordance with such requirements. Contract shall provide list of all spare parts prior to their uses for site activities. Contract shall record all spares used during site activities and update list on a monthly basis. Contract shall be responsible for ensuring that spares provided type and quantity match with requirements of equipment. Spare parts for normal operation. 1 year operational spare parts as such do not form part of contractor supplied items under lump sum contract price. Maybe it depends on conditions. Company or client may procure 1 year operational spare parts and capital spares through contractor, for which contract shall be reimbursed in accordance with provisions of appendix of contract. Well, it is condition depends. Prices quoted by vendors would be kept firm throughout duration of contract and no escalation in this regard shall be entertained by company or client. Is performed. SPIR forms SPIR procedure and sample SPIR form are enclosed within appendix. This is spare parts. Contract shall obtain through successful vendors. A completed SPIR form duly filled in within 3 months of placement of purchase order. 3 months of placement of purchase order, that within 3 months of release of purchase order, SPIR form must be submitted in 3 months. Following review of SPIR, company client may instruct contractor to procure 1 year operational spare parts. It shall be noted that 1 year operational spare parts are required to maintain facility immediately after completion date. Consequently, completion of SPIR forms with all related drawings etc. shall be undertaken expeditiously by contractor. Company, client, approved vendors and subcontractors. Contractor shall ensure that it procures equipment and materials only from company or client approved vendors. For procurement of equipment and material for which no vendor list has been provided by company or client, contractor shall propose suitable vendors. Contractor shall establish that vendors, suppliers proposed have previous experience of supplying similar types of equipment, materials to such type projects. Contractor shall provide all relevant information for vendor to be proposed to company client to determine suitability of vendor and its ability to comply with pertinent requirements of contract. All deviations to company client approved vendor list shall be avoided. When specifications call for a particular brand or type, certain proposed substitutions shall be subject to prior approval by company client. Company client approved vendor list, is continuing, we say, notwithstanding foregoing contractor, notwithstanding foregoing, contractor shall be fully responsible for procurement, timely, timely delivery and performance of vendors, equipment, materials and services. Should contractor propose use of non-recommended vendors, it shall present following information to company client in form of pre-qualification document for review and approval prior to placing related purchase order. Financial record demonstrating commercial stability of proposed vendor for last 3 years. Records demonstrating that vendor got appropriate and relevant industry experience and to put in particular experience for supplying similar items. Records demonstrating that vendor got services support for its products or services in nation of preferred or email list. Records demonstrating that vendor got services support for its products or services in nations email list. Records in form of correspondence confirmation from vendor demonstrating inability by listed company client approved vendors to supply equipment material. Once pre-qualification documents have been reviewed, once pre-qualification documents are reviewed, company client may instruct contractor to undertake registration of some vendor supplier with company or client material department before proposal submission of vendor supplier is approved. Construction. Construction. This was chapter 10, and let's say also construction. We are talking about something which is, you may say, construction, and this is you can say brief on that. It's very much brief on that. If you just go through file, well, just brief on construction it is, and everything is sometimes important. The contractor shall, I just introduce like this, contractor shall carry out all construction work in accordance with procedures or methods prepared during detailed engineering for all construction trades in accordance with project specifications. All details of facility shall comply with approved for construction or AFC drawings, specifications, all applicable engineering and technical standards and codes. Contractor shall plan construction in such a way that facility can be built, pre-commissioned, commissioned and started up in sequence. In particular, contractor shall commission utilities well in advance for purpose of startup facility. This is what I know to use means what we're talking about something which is going to be constructed by a contractor, and particularly because of facilities, there may be equipment, there may be, you may say, vessels, and there may be some other machines which are going to be installed either in field or in newly held area. So what we are saying what we have to do as a contractor. Contractor has to work in accordance with methods, specifications, detailed engineering, whatever we have. And we have to follow approved for construction drawings, otherwise we should not. Approved for construction drawings and approved specifications, whatever standards are available and referred to and codes are referred to. And planning is to be done in such a way that facility can be built, pre-commissioning, commissioning and startups in sequence. Is question of how best to construct this facility, what are best points to be considered directly. This is more important, and there should be given enough time. You have to plan accordingly. Means facility should be built. It's going to be built. Means pre-commissioning means we have. You can say contractor shall commission utilities well in advance for purpose of startup. General construction requirements. General construction requirements. Facility for project shall be provided and constructed in safe, timely and reliable manner. Latest construction techniques and equipment shall be used to provide an effective construction approach to achieve scheduled completion date. During construction of facility, contractor shall comply with company, client, safety and work permit. Procedure. Facility for projects shall be provided and constructed in a safe, timely and reliable manner. Latest construction techniques and equipment shall be used to provide an effective construction approach to achieve scheduled completion date. During construction of facility, Contractor shall comply with company, client, safety and work permit procedures, enforce a set of approved safety rules and precautions for work at construction site. When say during construction of facility, contractor shall comply with company, client, safety. You can say that contractor cannot do without safety rules, without specifications. Safety, health and environment supported by ergonomics must be taken care of in every activity of work, every discipline of work. It may be whatever branch, you must take care of this. You can see then contractor construction work shall include but not be limited to following requirements. These requirements are not limited, This depends on work item specification. Says obtaining all approvals and permits for work per company client relations. You may say, first of all, obtaining all approvals and permits for work per company client regulations, that's very important, particularly facilities areas, operating authority areas. We cannot go blindly. This is not civil area actually. We are talking of operational area where operation is very important. In that area I am talking. We must talk in that way. So we must have all approvals, all permits to work. Hot work permits, cold work permits, other permits, approvals, whatever it is required according to procedure must have. And we have to establish construction site safety rules. We have to train people, provide safety responsible people, officers, managers and staff. According to our safety plan, we have to do that. Now providing construction personnel, temporary works, temporary facilities and other facilities required for construction. Yes, because temporary works are done, preparatory works are done, permanent works are done, and therefore temporary facilities are required. Other facilities are required, which we have to think of and do. It's not only think of how to do it and do it. So providing construction personnel, temporary works, temporary facilities and other facilities required for construction in order to ensure proper performance of work in accordance with contract schedule from commencement of work. to its completion. Contractor shall fully adopt its organization for each specific phase of work to fulfill all contract requirements, and accordingly shall mobilize, develop and maintain overall functional organization, corresponding resources, including when, where and as necessary. She says contract shall fully adopt its organization for each specific phase of work to fulfill all contract requirements, and accordingly shall mobilize, develop and maintain overall functional organization, corresponding resources, including when, where and is necessary by providing. Now, it's very easy to think of, means we have to adopt as a contractor. We have to organize ourselves for each specific phase. There may be many phases in our project, and we have to fulfill each phase according to contract requirement or according to documents what we have, and accordingly shall mobilize, develop and maintain overall functional organization, corresponding resources, including when, where and as necessary by providing additional means. All construction means, construction equipment, scaffolding, all construction equipment, scaffolding, tools, testing, tools protection, testing and control equipment, auxiliaries, consumables, etc. and personnel, including management and supervision necessary for performance. Then we have to see, means whatever construction we are, do we comply with documents requirements? We can't go against that. We have to fully adopt our organization for each item, each phase. To meet requirement, we have to mobilize accordingly, develop and maintain accordingly. And resources that we do, where are necessary, all construction equipment, scaffolding, tools, protection, testing and control equipment, auxiliaries, consumables, etc. and personnel, including management, organization and supervision necessary for performance of work, in particular for handiness. Now, what we do, all construction, I repeat, all construction equipment, scaffolding, tools, protection, testing and control equipment, auxiliaries, consumables, etc. and personnel including management and supervision necessary for performance of work, in particular for handling, transportation, warehousing and prefabrication. Now, these shall include but not be limited to following. Let's say provision of maintenance and running of construction equipment. Provision of maintenance and running of construction equipment. Provision of safety equipment and tools, small and power both, for personal and works. Provision of mechanical equipment and material necessary for working in water-free conditions, whatever volume of flow it could be. Provision, storage, distribution and disposal of consumables. So we say provision of maintenance and running of construction equipment, provision of safety equipment, and tools, small and power both, for personal and works. Provision of mechanical equipment and material necessary for working in water-free conditions, whatever volume or flow it could have. It could be provision of mechanical equipment and material necessary for working in water-free conditions, whatever volume of flow it could be. Provision, storage, distribution and disposal of consumables like oil, lubricants. Then provision, storage, distribution and disposal of consumables, oil, lubricants, agencies. So provision, storage, distribution, disposal of consumables is oil, lubricants, gas, etc. and auxiliary materials, planks, timbers, tarpaulins, lumbers, etc. Provision of scaffolding and protection material from unsafe working conditions. Provision of materials and apparatus for technological laboratory to test materials. Welders' provisions of materials and apparatus. Then we may say we're talking safety here. It's very important point. Means say provision of scaffolding and protection material from unsafe working accidents. It's a very important point. Provision of scaffolding and protection material from unsafe working accidents, and provision of materials and apparatus for technological laboratory to test materials, welders, provisions of materials and apparatus to test all completed works. Safety equipment, whatever required for respective activities. Provisions of materials and apparatus for technical laboratory to get tested, test materials, welders, provisions of materials and apparatus to test all completed works. Safety equipment whatsoever required for respective activities. Providing accommodation, lodging and transport. This is value that you are getting of material buying, value you're getting of material buying or paying something, but you're getting only 40 to 50% of that. Because maybe your material is not according to specification requirement. So it's very important to note that all these points that we are considered for safety equipment whatsoever required for respective activities, providing accommodation and we keep on moving further. All these studies is a very important point. It's not simply how we can stop here. This is very serious issue of construction, and we have to achieve quality, and that point is very important in this sense. If we have to achieve quality, we have to keep watch on all this. Now, safety equipment whatsoever required for respective activities we need, providing accommodation, lodging and the transportation for construction person, pertinent contractor, subcontractor, vendor. We have to take care of each and everybody, because each and everybody is a part of project. They will be employed by someone else, but project is same, and everybody works for this project. Now, preparing construction procedures for work is another statement which shall be submitted for approval by company. So you can say preparing construction procedures for work, which is very important point, which shall be submitted for company client approval, while in addition contractor shall ensure that preparation of inspection and test plans in compliance with above, in compliance with method statement or procedures of and contract conditions to be submitted for approval to company or client. Execution and recording of all tests and inspection for equipment, materials and work. Verification, checking conformity of work and provide records. Issuance of construction method statements for company or client request. For critical works, contractor must be able to prove at all times that quality of supply incorporated within work complies with quality specified in contract. Contractor must be able to demonstrate or prove at all times that quality of supply incorporated with work complies with quality specification, quality quantity specification, and according to contract provisions. Say managing, contract coordinating and supervising work of subcontractors and vendors to ensure that work is performed in schedule and in accordance with quality and safety requirements. Preparing detailed schedule for work in accordance with execution. Program regular monitoring of time schedule and making appropriate adjustments to obtain most efficient uses, taking into account interfaces with telecommunication, electrical authority and other parties involved. Providing detailed manpower in construction facilities, deployment charts. Providing schedule and progress reporting in accordance with requirement of contract, progress reports, daily, weekly, monthly, etc. HSC report in detailed working. We can say work schedule, HSC report in details regularly, providing detailed manpower in construction facilities, deployment charts, providing schedule and progress reporting in accordance with requirements of contract, progress reports daily, weekly, monthly and flash, HSC report in details regularly, work schedules required at all levels from level 1 to level 5 or whatever we say lean, or you can say agile, or you can say we may say master schedule, we may say 3 months look ahead, or weekly and others. We can say physical progress reports reflecting actual status of progress on site, construction equipment status reports, supplies status reports, unpriced copy of purchase order. Say work schedule required at all levels, physical progress reports reflecting actual status of progress on site, construction equipment status reports, supplies status reports, unpriced copy of purchase orders, certificate of origin of all equipment and materials to be provided by contractor, monthly status of material taken over by contractor, material status and delivery schedule, updating list of work items, drawings, providing a quality assurance plan and developing quality control procedures, providing all temporary facilities required for work, erection, maintenance, dismantling and removal of all temporary site facilities, including all complementary works, civil, electrical, etc. inside allocated areas. This list is very comprehensive. It tells something about construction and it must be refreshed. I'll do that, no problem. Let's just go on. Now, it includes but not limited to that contractor and subcontractor site facilities such as office, workshop, warehouse, shelter, sanitary building, storage area, concrete or bituminous mix production plant, etc., including all complementary works, civil, raw, potable water and sewer networks, power supply, etc., inside allocated areas, lighting of works areas, temporary works to prevent personnel from injuries and or properties from damage, scaffolding and safety equipment necessary for works. Such scaffolding and safety equipment must be left in place as long as necessary to allow inspection, testing and controls. Contractor and subcontractor office facilities, company client office facilities, contractor and subcontractor warehouse. All site facilities for contractor need to include but not be limited to power supply cost for contractor use, water supply, potable water supply cost for construction use, potable or water supply cost for construction works use except for piping hydro test, raw water supply cost for piping equipment hydro test, treatment of raw water for hydro test, nitrogen supply for pre-commissioning work, nitrogen supply for works including cost for contractor use, air supply cost for contractor use, disposal of all sewer and wastewater, rubbish and trash, fuels and lubricants for temporary facilities and construction equipment, maintaining construction records in formats to be submitted for company client approval, ensuring timely mobilization of vendors, representatives and or other specialties and their retention at construction site for required duration, providing QA/QC and inspection services for work which will include but not be limited to civil, structural, welding, piping, mechanical, electrical, instrument painting and inspectors. Contractor shall mobilize a third-party inspection agency to perform following requirements such as non-destructive test and interpretation, civil lab testing, load test, all other required personnel and QA/QC inspectors shall provide by contractor. Contractor shall mobilize adequate level of inspectors. QA/QC procedures and equipment shall be subject to company client approval. Maintaining and operating an adequate system of controls pertaining availability of drawings and specifications with latest revision of all places where work is performed, maintaining and operating an adequate material control procedure at all places where work is performed, assisting company client with technical safety. You may say maintaining and operating an adequate material control procedure at all places. Maintaining and operating an adequate system of controls pertaining availability of drawings and specifications with latest revisions at all places where work is performed. Maintaining and operating an adequate material control procedure at all places where work is performed, and assisting company client with technical safety reviews to confirm that facility can be operated, maintained, shut down and started up in a satisfactory manner. Managing field quarters, field queries, field changes and revision of drawings. Preparing a complete set of data sheet, specifications and as-built drawings. Preparing ringing studies as required. Mobilize in a timely manner construction management team to construction site in nation. Contractor should in particular submit detailed construction execution plan. Detailed construction execution plan taking into account all site constraints. Mobilization plan in details. Scaffolding plan including resources, technical solution proposed, material specification and scaffolding management according to HSC procedures. Nominative organization charts down to but excluding foreman level and corresponding CVs included for all key personnel to supervise on site and controlling coordination. List of resources assigned to work. Personnel per category, nationality and split between different disciplines. Significant activities with each discipline as required in particular exhibits. Construction equipment, type and quantity. Allocation of site temporary facilities and storage areas to contractor. Site temporary facilities, detailed layout. You may say providing housekeeping, site temporary facilities, detailed layout, drawings and descriptions. Then site storage areas, raw materials, finished materials, detailed layout. Provide housekeeping personnel for work on basis of 1 cleaner per 25 persons. Reinstate existing roads, track, channels and secondary roads to original conditions and specifications. Arrange for protection of turtle eggs during construction. Contractor shall do whatever is necessary to take care of rock obstructions and unsuitable materials present. You can say arrange for protection of turtle eggs and contractor shall do whatever necessary to take care of rock obstructions or unsuitable materials present within construction site. Contractor shall dismantle and remove cross numbers temporary coffin dam, take ownership of sheet piles and tiller precast units to plant port as directed by company client. Contractor shall within 30 calendar days from contract effective date supply and install its dewatering system in coffer dam constructed by other contractors. Contractors aware about buried services, pipe, cable and duct within battery limits and coordination with and say company client plant for as-built drawings shall be required during detailed design, and that hand excavation is also required in certain areas during construction unless confirmed in writing by company client. Precaution and preventive measures. Preventive maintenance of materials. You can say then contracts aware about buried services and a important point with the battery limits and contact coordination with company or client for as-built drawings shall be required during detailed design, and thus hand excavation may be required in certain areas during construction unless confirmed and writing by company client. Protection and preventive measures, maintenance material handled or supplied by contractor or state of art and suppliers' recommendations. Well, these are certain points, only few points only that I'm giving you. It's not entire one. These are practical activities to be done and must be known. You cannot simply do everything in one day. I'm not saying that. But you should have a clear idea what you're going to do. Being a responsible leader, without having this concept or reference you must have. These are written in documents as well. But it's not easy without referring to documents and reading them. And reading them means it takes concentration off. You're tired in many cases. Because why I'm doing so many things together? That points come to picture. But it's not in 1 minute, 1 day. Project is long duration. Job is also long duration. You are also long duration there. So read step by step and go on and on and on. Point is that we have to understand what we are going to do, and that's very important point. Coordination, again I say, coordination is very important. In engineering world, in project engineering world, in design engineering world, or you can say implementation engineering, execution engineering, supervision engineering, coordination is very, very important. If you do not take care of coordination, coordination shall not take care of us. That's why I say it's a part of very much with quality. I can say it's very much part of engineering, and application must be effective. Engineering quality non-conformance product is called substandard and therefore rejected, and we can say quality must be everywhere, in procedure, everywhere in location, everywhere in work, everywhere in design, everywhere in system, and individual and element, and then designs. If design contains all this, okay, construction shall be smooth, with detail, quality, and well, I think for today it's enough food for time being. It's enough food for time being, I can say. Let's move on to closing this. I think it will be fine. All right. So let's move on forward and close this. Thank you very much. We'll meet tomorrow again with COVID and more. I hope you will take care. COVID is also part of engineering profession because of his safety, health, and engineering. We should concentrate on that. Statistics I give you just for your reference, and it's interesting one also from academic viewpoint, from experience viewpoint. What's happening has not happened, but that's happening. What to do?